Dr. John Amoesi leads the Global Health and Infectious Disease Research Group at KCCR and is also a lecturer at the Global Health Department of the School of Public Health at KNUST. He joins us via Zoom for more on this one. Doc, I'm grateful for your time. First of all, what's your view of how the Delta variant is spreading in Ghana?
For that, Aisha, and good afternoon to everyone who's listening. Normally afternoons are busy, but I agreed to come on this afternoon because I think it's really important that we highlight what is going on in Africa and in our country, Ghana. The Director General of the Ghana Health Service, put it correctly that, cases are going up. And the truth also is that our intensive care units are also filling up. I think that needs to be highlighted. There's a way in which this disease works, and we've seen it over and over again, not only here in Ghana, but in other parts of Africa and all over the world, which is that it starts off really slowly with an increase in number of people testing positive, and then moves on to an increase in number of people who are getting sick, and then moves on to a number of people, to more people getting hospitalized, and then finally it moves on to more people dying. So if what we know is anything to go by, it means that we haven't yet hit the most critical spot, which is almost bound to happen. It's also important to note that at the point when you're able to realize that there is increasing spread, it really means that it has seeded quite significantly within the population, because people will not get tested unless they have a cause or a reason to get tested because they're feeling unwell or have treated some other disease like malaria and others and was not going away, and then decided to go for a COVID test. And so what we're seeing now is only a reflection of something that must have started about a month to 6 weeks ago. And with regard to the Delta variant, as Dr. Matshidiso Moeti put it, it's really a beast in the way in which it behaves. And if you look at the data, which is coming from other parts of Africa and all over the world, but let me focus on Africa, especially with regard to how this Delta variant spreads and the risk of getting it and risk of severe disease. It is alarming. People have been vaccinated and are still getting the COVID, albeit not falling sick. So if that's anything to go by, it should tell you that those who are not vaccinated are most likely getting it in much higher numbers and are also more likely to fall sick. And just within my own sphere, I can see very clearly how people who've come into contact with an infected person get the disease, and those who've been vaccinated just don't get the disease. We've had a few people who are vaccinated who have tested positive but are just fine. But what that means also is that they can go on and spread it to others who may not have been vaccinated, and they may not be as lucky as themselves. So we're in a situation where we don't have the vaccines right now. I'm just coming out of a high-level discussion which was looking at vaccine availability across Africa. And very clearly, the WHO headquarters made it very clear that there are challenges with the COVAX facility. And I know Ghana is trying hard on our own via bilateral agreements and other things to secure vaccines, but we don't have them yet, and they're definitely not coming next week, which means that we should expect that this is going to go high. My only hope is that it doesn't translate into a significant number of deaths. But again, as the Ghana Health Service Director General put it, yes, the number of severely ill people is not that high, but it has gone up very significantly, even from last week and especially last 2 weeks. And what that means is that we're getting closer to the point where it begins to translate into deaths. And this is what I am very concerned about. And the only thing that we can do right now is to really insist on the measures, the social distancing, the washing of hands, the wearing of the mask. I mean, just today, I had to speak to one of my managers in a facility and ask him to wear a mask because someone had called me to complain that he was not wearing a mask. And these are just what we're facing. Even healthcare workers are getting weary of doing the right things. So we have a real problem, and I'm happy that the media has decided to resurrect this issue and give it the attention it deserves, because it really translates into a matter of life and death.
Dr. Amoisi, we seem to be gradually getting back to a worrying situation because the WHO says vaccination drive is slow. There's rapid spread of the Delta variant, termination of our contracts to get vaccines. What can we really do as a nation?
Well, that's what I pointed out. The only answer is in vaccinating as many people as quickly as possible. Now, that option is currently not on the table because we don't have the vaccines. So it's not an option. So the only thing we're left with is reducing contact as much as possible and putting in place all the other preventive measures like the washing of hands, wearing of masks. And so it sounds so hackneyed because we've been saying this over and over and over again. But unfortunately, this is all that we have left. There is nothing more we can do at this moment. Perhaps we need to take a second look at some of the legislation that has expired, which really compels us to do the right thing. Maybe this is the time to go back to the drawing board and look at it. If we had the vaccines that I said, let's speed up, get those vaccines in, but we don't have them, so that's off the table. So really sorry to disappoint you, but nothing special to do apart from what we know already.
Is it time for restrictions?
Well, I mean, if I'm to speak as a public health person, yes, there is time. It is time for restrictions, but restrictions are implemented at different levels. So it's personal level, and then there is more population level, which comes via public health law or legislation. It's always a combination of the two, the individual level kind of restrictions and the population level restrictions. I would call for a review of the population level restrictions by the authorities, take a really hard look at our figures right now, look at the modeling and what the projections are, and make some quick decisions within the next few days. Otherwise, we might see even more numbers. And what I said is I really don't want to see this translate into deaths. And unfortunately, when it begins to translate into death, then it's a bit too late. So this is really the time to take a second look at legislation and other population level restriction measures.
Dr. John Amoisi, I'm grateful for your time. He's a public health expert with KCCR and a lecturer at KNUST.